Pass it on to you, Dr. Holt. Thank you for joining us today. Welcome, everyone. Dr. Holt, take it away.
All right. Good evening, everybody. All right. Good to see everybody, and hope all is well. And Merry Christmas, season's greetings, Happy Hanukkah, all that and some. So we're very thankful. I'm very thankful, very humbled that you decided to want to have me to do your trauma training out of all the practitioners that's out in the nation. My name is Dr. Demonte Holt. I am a certified traumatologist, trauma crisis specialist, mental health specialist, a restorative practice practitioner as well. And so I have the distinguished pleasure of helping people heal for a living. So I get to get a lot of sleep at home because I get a chance to help people's lives improve on a daily basis. And so, again, thank you. I believe I met you guys through the Metropolitan State University WEAC a while back. And so I'm still one of the expert consultants for MSU of WEAC. And so we've been very, very busy, especially with COVID going on. And so today we're going to be talking about addressing, I think it's very, very relevant, addressing COVID-related trauma and all of the preconditions that our educational system have been through. And so as mentors, you're going to be dealing with many youth that have experienced a lot of levels of trauma from COVID, let alone many of the preconditions that they were experiencing before COVID had happened. And I just did a survey and a focus group of 3 different groups of 9th, 10th, 11th, and 12th graders at a high school in regards to assessing culture and climate in regards to COVID. And it was intriguing to listen to many of their concerns. And so I'm going to be talking a bit about that as well, because I think as mentors and volunteers, as we pour into our children and connect with the youth, especially at-risk youth, that we understand what's going on in the little brains of those. It's probably going to shock you that if we don't address how the brain has been injured and hurt and wounded because of the traumatic experiences, then you're going to be spinning your wheels on behavior. That is the big $1 million question that I get all the time about addressing behavior in academics with our young people. But when children have experienced many psychological TBIs, and TBIs is traumatic brain injuries. And yes, I'll be talking about defining what trauma is, and trauma is a brain injury. Psychological trauma, when things that transpires in young people's lives, they're not the same. It's more than just pick your head up and move on with your life. It's not that simple, and I want you to understand that. Some of the behaviors you see with kids has absolutely nothing to do with you. So get out of your feelings. Don't take everything personal. And when you're dealing with kids with high levels of trauma, you're going to have to get into the profession of learning how to have short memory. So if you're going to stay mad at kids for 2 years because of something dumb they said 2 weeks ago, you're going to have a hard time being a mentor. I can tell you that right now. Yeah, I can tell you that right now. So you better be a person of short memory, learning how to suck it up and say, hey, this has nothing to do with me. This is some of the things that they've been going on way before I start mentoring them and working with them and being their educator. Okay, so I'm just throwing some of those things out there. So I'm born and raised Flint, Michigan, from the hood of Flint. So I consider myself a trauma survivor. And I was born into trauma, lived in trauma, and thank God, by the grace of God, I was able to pull out of that. Most of the guys I went to school with are dead or in prison, and so that was kind of like my outcomes. But it was because of people that didn't give up on me. Institutions didn't give up on me. People showed me how to have grit and resilience and how to rise above it. But make no mistake, I gave people some problems. I gave them the business. They was not about that life. I can tell you that right now. But the reason why you have a Dr. Holt is because the people didn't give up. And that's what you're going to have to be. You get a choice. You either get to be a thermometer and just tell us the temperature in the room, but I hope that you're a thermostat. You can change the temperature and maintain the temperature. And that's the mentors that you're going to need to be. What kind of mentor do you want to be? You want to be a thermometer? Do you want to be a thermostat? And so all you can do is talk about what's wrong with the kids and all of their problems, all the behaviors. That's the thermometer. You're just telling me that it's 72 degrees in a room. But can you be that thermostat and impact that life, change that child's trajectory? That's a thermostat. And so I want you to be a mentor who's a freaking thermostat, that not only that you change the environment, but you can maintain it, right? So yeah, we're gonna have some fun. I just want to let you know I'm not scared of nothing. We're gonna talk about it. We're gonna be about it. It's going to be on a science level. It's going to be on a scholarly level, but it's also going to be on a practical level as we move forward and talk about trauma. So today, I hope I can share my screen. Let's see. All right, so I do have capabilities. All right, so we're going to be talking about resilience about trauma during COVID. And so I'll give you a little bit more history on my work. Obviously, I'm on all of the school districts nationally in regards to dealing with trauma. I'm doing trauma informed. I'm doing two things. I'm doing trauma informed, and I'm also doing trauma responsive practices. So that's something that you probably want to be taking note too. It's one thing to get informed, but it's another to be responsive. So a lot of people is being informed, but they don't know what to do with all this knowledge. My job is to make sure that you are also trauma responsive, that you have the tools in your toolkit to be able to work with children and youth and at-risk youth that have early childhood trauma, that have high ACEs. I hope you know what ACEs is. I'll talk a little bit about that. And also, but the more important thing is, how do we heal? And so my training is big on being asset-based and strength-based. So we don't just spend a lot of time talking about the bad experiences, but more importantly, creating spaces of healing. I'm also doing trauma-informed justice systems right now. And so that is huge, guys. You know, what does a trauma-informed court looks like? What does a trauma-informed probation? What does trauma for pretrial services and juvenile detention centers look like? So I'm right now doing a huge research, and I'm doing training on this other thing called the traumatization of incarceration. The traumatization of incarceration. What does being confined in a jail, juvenile detention center, or what does prison do to the brain of incarcerated people? So that's huge. So that's a big thing too. So I have a lot of training out there in regards to trauma. Another one is also race-based trauma. What does racism and discrimination and hate crimes, what kind of impact and rewiring does it play on the brain of those who have experienced hate crimes and microaggressions and racial slurs and just been attacked because of the color of their skin or because of their culture, just because they're different? Oh my God, let me tell you, it has a huge impact. Hypervigilance is real in communities of color that experience high levels of racism as well. And that will impact some of the mentees that you're dealing with, especially mentees of color, okay? So let's get into it. All right, y'all ready to get into it? I'm ready to get into it. It's kind of late, so you might as well have some fun, all right? So good to see all the smiling faces out there. I'm glad y'all don't look all deep and so mean and, you know, like you can't learn anything new. So we all learning together. So thank you for your time. Let's help people heal. So we're gonna talk about resilience above trauma during COVID, because certainly we've already been dealing with pre-existing conditions in regards to trauma, especially early childhood trauma. Some of those things I'll talk about. But the fact of the matter is, COVID is real. The struggle is real with COVID. We're now getting different variances. We have a new variant that we're concerned about. We're seeing a resurgence of infections in regards to holiday gatherings, you know. We're not all the way out of the woods yet, so we're not post-COVID. So this is very, very relevant to still be talking about dealing with COVID-related traumas, okay? Let me get started here. All right, everybody see my screen? Thumbs up, you got it? See it? Good stuff. All right. So again, as I alluded to, I'm a traumatologist, trauma crisis specialist. Also do hypnotherapy for people with PTSD as well. So I'm a hypnotherapist as well. So yeah, I'm the trauma guy, but I like to look at it as I'm the guy that likes to bring healing to an individual's life, not just treatment of symptoms, but bringing holistic healing. This is going to shock your mind, but trauma impacts the whole person. It's not just some mental thing. Trauma obviously impacts your neurology. You can take notes of some of this stuff because this will not be on the slide. So I'm just shooting from the hip on some of this stuff because I want you to walk away with some gold nuggets. Trauma impacts your neurology. Number 2, trauma impacts your psychology. Number 3, trauma impacts your physiology. That would be your body. And I'm going to blow your mind, guys, because trauma is also spiritual. So sometimes trauma impacts people's theology. Theology is the science of God. Now, why would you bring this into this spectrum, Dr. Holt? I'm glad you asked me, and I'm going to tell you. The reason I'm telling you this is because some people want to know when they were violated, when they were assaulted, they want to know where was God in this. And sometimes trauma impacts people's faith. And some people's faith have really diminished when certain things has happened. Actually, some people have walked away their belief system, their God or their deity or whatever that looks like. So yes, trauma also impacts people's theology as well. So there's also this spiritual piece that trauma does to the soul of individuals. It really cuts to the deep down into the deep depths and crevices of an individual's inner parts as well. So it's not just this mental emotional thing, it also can be a spiritual thing. Okay. So again, you guys know me from Metropolitan State University, Denver. For those, we did some work with Dr. Darlene Sampson. We did some work together with you guys. So thank you for having me coming back. Still represent the WEAC Center. These are our region, Rail Region 4. These are our territories by which we offer services and training. These are some of the things that I specialize in, and then some. I'm also an American Red Cross instructor, authorized service provider. So I also train people in adult pediatric CPR, first aid, basic life support, advanced life support, professional rescue for nurses and paramedics, all that stuff. So just throwing that in there, all right? So I love kids. I think that if you don't love kids, you shouldn't be a mentor. So I'm not scared to tell you that. I'll tell you that right now. If you don't love kids, if you're just bored because you're retired, you don't have nothing to do, and so you just want to pick up and just grab some kids and kumbaya, I'm telling you right now, trauma will kick your butt. You better have more of a plan and a passion and a love for kids. I say this everywhere I go, guys, so this is nothing new. I'm telling you as mentors, I tell the teachers too, what you in the classroom with kids for when you don't love kids? You should have been an engineer, someone working on systems, right? If you're going to work with kids, you got to love them. I hope you do, because there's going to be so much that comes with children with a lot of trauma that if you don't love them, they're going to see that within the first couple of weeks. They may not have master's degrees and PhDs, but they can see through a lot of BS. Okay. So they want to know, are you authentic? Are you in this thing for the long haul? Or are you just doing this because you want to feel warm and fuzzy and make you feel good? Okay. So this has to really be about kids, and the direction need to be about how do we help kids heal? Now, the good news is Dr. Holt also looks at what does the professions look in the room, because secondary trauma is real. And so what we also seeing is mentees, teachers, counselors, social workers, school psychologists, everyone that works with people with a lot of trauma is also affected by that same trauma called STS, which stands for secondary traumatic stress, which means if you keep working with people with a lot of trauma, and if you're not aware of your own personal traumas, then their traumas can trigger you. And one of the worst things you can do, ladies and gentlemen, mentors hear me really good, a dysregulated mentor cannot help a dysregulated mentee. Okay? If you're dysregulated and triggered and hot and bothered and out of pocket, you're not going to be able to help these kids. As a matter of fact, they're going to trigger you and you're going to say, I quit. So we don't want you to suffer burnout and compassion fatigue, which is a whole nother conversation. Okay. So Frederick Douglass said this is a lot of my work is based on this powerful statement. It is easier to build strong children than to repair broken men. Think about that when you're a mentor. It is far easier to build stronger children than wait till they get grown or wait till they become an adult. And now they have all these psychotic and psychological problems. In other words, really, a lot of our adult issues are unaddressed childhood issues for a lot of us, if we really be honest. And that's what I like about doing the ACE assessment, because it really brings it all home as we begin to look at those 10-point questions, from being abused, from someone being on drugs and substance abuse, or from asking questions in regards to having a person that's incarcerated, goes all the way down, dealing with a lot of things. And so when we begin to look at your ACE score, we can tell that, okay, even though you may be in your 30s and your 40s and your 50s and 60s, there's some stuff happened to you when you were 6 and 7 years old that was not addressed. And that kind of explains why we see a lot of dissociation and we see a lot of hypersensitivity and hypervigilance in adults today. Does that kind of make sense? Good. All right. So a lot of people say, what the hell is a traumatologist? I don't really hear that much. So I'm a specialist in regards to trauma. So you have some people that do trauma-informed trainings and stuff like that, and that's good, right? But then you have people that's like me that are PhDs and postdoctoral researchers that eat and sleep trauma, okay? And that's what traumatologist is. So it is a science, it is a specialty in the field of psychology, just like cardiology would be a specialty in the field of medicine, okay? So think of it in that kind of way. So when we looked at trauma, ladies and gentlemen, it looked like a lot of things before we got the science of today. And so today I want to bring my brain with me. So I do have a brain in my head. Obviously, I wouldn't be able to train if I didn't, but I want to bring this one. This is my second brain that I like to bring with you. I want you to see it real good because this is what we consider one of the most complex organs in the body. It is very intriguing to learn so much about the brain. But this brain can really suffer from a lot of TBIs, traumatic brain injuries, and the brain can be impacted by things that we have been through. But the good thing is we can rewire the brain for healing. So this can be rewired. This can shift. If we give it the right resources that it needs to be able to be rewired, it can be done. And so I want you to see this brain because this is what a lot of our issues are. So what we do is we pour a lot of millions of dollars into programs and projects and initiatives, but we never looked at touching the brain. Well, if you don't deal with the brain, it doesn't matter how much money and resources you spend in something. If you don't create healing for this, then the outcomes of individuals are not going to improve. So I always say that in order to change your life, you have to heal the brain, okay? In order to change your life, you got to heal the brain. Now, we don't expect you to be psychologists and psychiatrists and neurologists and neurosurgeons and all of that, but you do need to have enough information to understand that when the brain has been injured at such young ages and those brokenness have not been addressed, then this is going to be a big problem here, okay? And I tell school districts, you can't suspend your way into a solution when the brain has been injured. You can only kick the kids out for so long and expel them, but at some point you're going to have to deal with this thing right here called the brain, okay? And so when dealing with this brain in the 1800s, doctors began to see symptoms of trauma, but it wasn't necessarily called trauma. And we didn't have post-traumatic stress disorder known as PTSD into the 1980s. But we were seeing, doctors and specialists were seeing a lot of common denominators for our symptoms in regards to the brain being injured in wartime. So soldiers reported missing home, feeling sad, sleep problems, nightmares, anxiety. And so when we began to look at, well, where did all of this trauma-informed come from? Obviously, there's been some history. It's a buzzword now. Everybody talking about trauma and trauma-informed. But it was coming through science. It was coming through medicine. It just looked different because we was trying to get our hands on these symptoms to help people. And the most of it was really coming from veterans and wartime soldiers coming back home. And when they came home, they was not necessarily the same. So trauma was called trauma neurosis. In World War I, it was called shell shock. World War II was called combat neurosis or operational fatigue. During the Vietnam War, trauma was called post-traumatic stress disorder, which we now have. In the DSM, by which that's the book where therapists and counselors and practitioners, mental health practitioners used to do diagnosis and treatments. DSM-2 called it hysterical neurosis. DSM-3, which is the different versions, they kept updating. So you see DSM-2, DSM-3, these are updated versions to the book by which practitioners do diagnosis, okay? 1980, we got post-traumatic stress disorder, DSM-4. It's called PTSD, DSM-5. In 2012, the trauma was called the trauma spectrum, okay? So let's talk about the ACEs. How many of you guys have heard of ACEs? Adverse childhood experiences. Okay, that's going to be very, very crucial to your work, is understanding ACEs. And so pretty much in the 1980s, ACEs was done by a few practitioners and physicians, and they got 17,000 participants to assess early childhood trauma. And so that's where we get the 10 questions. And when they began to ask these questions, the higher the number of these participants, the higher the negative outcomes were those individuals, okay? And so, and pretty much in a nutshell, it would ask questions about abuse, ask questions about neglect, and ask questions about household dysfunctions. And when that 10 questionnaire was done with many individuals, people began to realize they had 5 ACEs, they had 7 ACEs. I did one ACE assessment at one school. The principal, I think, had 8 or 9. So a lot of people was really shocked, like, wow, I didn't realize how much my work can really trigger me, or I didn't realize that it was my work trigger me until I began to look at my own personal ACEs. And so I always ask people that's working with individuals with trauma that they assess their own personal trauma, because it's going to be very important that if you're not cognizant of that, then it's possible that the youth that you're working with can also trigger something in you. Matter of fact, some of you became mentors because you were an individual that came from trauma, and you're working as a mentor to prevent and not repeat some traumas in the next generation. At least I think that, I'm assuming that some of you guys feel that passionate, like, hey, I've been through some stuff. Let me catch the next generation so that they don't go through some of the same things that I've went through. Okay. So we saw the outcomes were very, very alarming and concerning. So again, looking at the 2 questionnaires, have anybody, I know you probably heard of ACE. Have you guys ever done your own ACEs? Have you done your own assessment? Yes? Okay. All right. So these pretty much are the questions that's on that assessment. And the more, I believe it's 4 or more ACEs is a big concern, okay? Because what happens, it opens the door to a lot of negative outcomes. I believe I had my pyramid, there we go. From the bottom up, generational embodiment, historical trauma, social conditions, adverse childhood experiences, disrupt neurodevelopment. So one of the things I'm going to be talking about is early childhood trauma is very dangerous, because especially when we're dealing with early traumas, it not only impacts the brain and rewires the brain, but it impacts it in such a way, especially in crucial times of development, I would say between 0 and 5, is that it does impact neurodevelopment. And so this neurodevelopment and lack of development will also opens the door for what we see when kids enter kindergarten. Between kindergarten and 3rd grade, they begin to show all of these delays in reading and delays in language and delays in many different areas, because people don't really tie, or we wasn't years ago, certainly 20, 30 years ago, we wasn't tying early childhood trauma to a lot of these things. But what we realize is that when infants, babies, toddlers, and adolescents experience a lot of early childhood trauma, this explains a lot of the things that you're seeing when you're working with young people or working with at-risk youth. So this would be very, very important for you to see. Also, early childhood trauma unaddressed takes about 10 years off your lifespan. So we also see people who have a lot of trauma, because again, what I alluded to before, is trauma impacts the whole person. It also impacts your physiology. So we also see people who have high ACEs have more chronic disease, such as strokes, because strokes, what triggers strokes? a lot of stress. Well, if someone has been through extreme stress since they've been childhood to their adulthood and maybe in their middle age and never address some of these things, these are some of the reasons why we're seeing high levels of chronic diseases as well. Another thing we want to consider is that trauma also impacts your genes. So there's something called epigenetics, which means that it also impacts your DNA. So this is some really serious stuff when we talk about trauma. Okay, so when I look at trauma, I look at it from not just from a student's perspective or a youth perspective. I like to think about, if we're going to really effectively address trauma, it needs to be a whole community, a school community, or if it's a youth group, or if it's a youth program, it needs to be the whole school community or the whole agency community. So when I think about trauma, I'm not just thinking about the youth per se. Now, they're very important because you wouldn't even have a job if it wasn't for them. But we also need to make sure, are you okay? Because a lot of times we don't ask the adults in the room, we don't ask the professionals, we don't ask the staff, are you okay? So it's one thing to look at it from a youth perspective, but I want you to look at it from a caregiver's perspective. And so when I look at mentors, I consider you like the educator slash caregiver, and you are impacted as well from trauma as well. And so if you're not cognizant of that, it most definitely can impact you. Okay. So trauma can look like child abuse. You're going to be getting these type of mentees, abuse of all kinds, from verbal, emotional, physical, and sexual, neglect, poverty. A lot of times we don't really associate poverty as being a traumatic experience, but I'm gonna tell you right now, if that kid haven't eaten in 3 days, and you wondering why they act in the way that they're acting, or there's high mobility because there's homelessness, especially with more moratoriums are ending, so people are being foreclosed and evicted. Yes, that's going to impact them. That's going to impact them. Okay, and poverty opens the door for many other things, from homelessness to hunger and starvation. And we also know that mass incarceration as well is something that's also on our ACE score. When we ask questions, it has anyone been incarcerated, because that separation of families, that hits a lot different when a major caregiver or parent has been removed from the family structure, from income to social psychosocial support. All of those things are impacted as well. So please consider those things. Divorce and domestic violence. One of the things when I do group sessions with a lot of my kids and my youth, believe it or not, about 50 to 60%. It's usually, if I grab a student of 12 and I hit divorce, it's about 6 to 7 kids out of a 12 person group has been impacted in some kind of way with divorce. So so consider that as well, being a traumatic experience. And listen, guys, when family structures is a huge problem, because that's the big system that they depend on. When that system fails them, that really puts them into a mind frame of dissociating and disconnecting and having attachment issues. So if you're working with kids that are having a difficult time trusting you, yeah, trauma is really real. Community violence has a lot to do with it. And so being traumatized by just being incarcerated is the issue. Some of your kids is going through grief as well. So some people have probably passed away already, or have been infected by by the COVID infection and COVID virus. And so they've seen loved ones pass away. And sometimes you're also seeing a lot of grandparents raising kids all over again. And so, but they're older now. They also are prone to be sicker now. So what happens when those grandparents who are caregivers begin to get sick or pass away due to a terminal illness? So grief is a huge piece of what a lot of our kids go through. Foster care. So you probably have having some kids that being mentors, that you seen some kids, by a show of hands. Have you had anybody? Let's show of hands. group homes, foster care, going through some of those systems. That's really, really tough on kids, you know, because they have to suffer with rejection. I'm working with, as a patient in therapy, a professional. I mean, we're very, very successful guy that struggle with depression and to struggle with suicide and to struggle with substance abuse because he was adopted, and he put all that pain and rejection in some dark place and just ignored it for like 30 years. And as a result, he suffered from extreme dissociation. Like, he has a difficult time building friendships and relationships. I mean, I'll give you another picture of what it looks like. So I asked him, I said, "What are you doing for Thanksgiving?" He said, I don't ever spend any time with people Thanksgiving. I just sit at home and I just do my own thing. Like, I don't like to, if I feel myself getting close, someone wants to get close to me, whether it's a friendship or even a romantic relationship, he said, I do everything to destroy that type of bonding with people. This guy's like in his 50s, and I'm working with him of stuff that happened when he was a child. So I'm just trying to show you that if you're having some mentors, some mentees that are struggling in a lot of these areas, it's because of early childhood trauma. So I'm just trying to help you to see a bigger picture, okay? Separation of families, you know, especially in our Latino and Latinx and Hispanic communities, is a very traumatic experience. Bullying, maybe some youth that you're working with have been victims of bullying or told you about how they're being picked on because they're different and because whatever that situation is. And so that creates psychological ramifications as well, is when bullying has been unaddressed. And so especially when schools don't take bullying serious, or teachers or staff, they just ignore it, like, oh, this is just kids. Suicide is high during victims of bullying. This is no joke. Anxiety is high. With bullying, 160,000 kids are afraid to go to school due to bullying, okay, because of anxiety and depression and things of that nature. So you want to be also being cognizant that bullying is also a very traumatic experience for people. So I also talked about the teachers in the room, the staff in the room, who's working with youth. That we need to be watching out. So you need to be watching out for your own personal burnout as well. And you can get impacted by the work that you are doing. Okay, so that was all preconditions, right? So now let's look at COVID. Let's look at the beast. And COVID has exacerbated a lot of our already pre-existing problems that we were having with families and with communities and with school systems, with justice systems. All COVID did is really pull the cover off of how ugly trauma really can be, okay? What we did see is that 91% of students that you're going to be working with as mentors were impacted due to school closings, okay? Depression was high. It increased up to 43%. Anxiety, it can increase up to 37%. The anxiety and depression was impacted by 31%. What we also found out is that 52% of children felt bored. So when they were going through that COVID and being looking at their teacher through a lens on camera, everybody was burnt out, even including the teachers. Like, what the heck is this? Like, this is extremely challenging. How do I get 15 to 20 students to stay engaged with me from morning to afternoon? And a lot of kids was like, the heck with this. And so kids were open up YouTube windows and open up games, and they wouldn't even pay attention to what was going on. I mean, they just totally shut down and dissociated. 52 felt that they were bored, 52% felt that they wasn't learning, 74% was concerned about their social activities. And then we had the recession, where the economy just plummeted and joblessness was all over, was throughout the roof. Unemployment was crazy. People lost their jobs and lost their income. I did a focus group. Again, I was telling you about the high school. And one of the issues that came up was saying my family still have not financially rebounded. from COVID. We are still struggling. I'm concerned where I'm going to live when that last bell ring at school. I'm concerned where we're going to live. Why is this all important, Dr. Holt? Because these are some of the same situations that your kiddos is going through. This is what's on their mind when we're working with them. Okay. And obviously we can't ignore racial tension in our country. So if you're going to be working with kids of color, African Americans, Latino, Native Americans, and now we can say Asians, because we saw also the Asian Americans were also being experiencing hate crimes as well. So we're working with these individuals of color, youth of color. Please understand that race is an issue and is important of what they have experienced. Okay. So racial trauma is real. So I alluded to that that's not just something that people just saying, but no, it does impact the brain. It does make it hard when you have experienced a lot of discrimination and been victims of racism, on to build trust and to have and build those attachments. And so, especially if you are mentors who are white working with Black youth and brown youth, they want to know what your intentions are, what your motives are, and how long you're going to work with them. It get hard. Are you going to quit? Are you going to throw in the towel and give up? I'm just being very honest, you guys. So you invited me, so I'm going to be myself and tell you, okay? But I want you to be thinking about that as well when you're working with youth of color, that some of these things can come up, and they probably want to know how serious you are with working with them. Do you understand them? Are you culturally relevant? You know, and not, well, you know, my mailman is Black, so I understand Black youth. No, just because you got a Black mailman, a Black UPS driver dropping your boxes off, don't mean that you're culturally relevant. So sometimes you have to do your due diligence to really expand your knowledge and expand the struggle, and expand your knowledge of the struggle, so you can be very relevant for what a lot of our young people go through. Okay. So let's get into dealing with what in the world is trauma. Okay, I'm glad you asked, because we need to understand what it is. So trauma is two things. Trauma is when this brain here is impacted by certain circumstances, life devastating situations, life threatening situations. Your brain responds, and it impacts the brain. And so how I look at when the two things that I define trauma in is two things. One, trauma is a psychological, emotional wound to the brain. So when devastating things happens to you, happens to people, the individual that you are being mentored to, it really does something to the brain. It really does. And so it's a psychological wound. But then secondly, trauma is a stress that is so overwhelming that it's difficult for that person to cope with it. Okay. So we're not talking about ordinary, just stuff that gets on your last nerve kind of stress. We're talking about really overwhelming stress that gets you triggered, gets you dysregulated. Okay. So that's what we look at what trauma is. And we have to shift from being trauma informed to being trauma responsive. So I talked a lot about that, by getting tools in your toolkit to be able to work with people with chronic stress. Okay. And so I have a whole nother kind of training on trauma responsive practices that you may be interested in the future, where we just talk about tools. What do you do and how do you do it, and what not to do, and what not to trigger, and all of those things. So those things are very, very important. So when we look at trauma, look at this slide. I think it's very powerful, because I want you to think about trauma just don't hit this one part of us. I think when I say it hits you holistically. You get this bigger picture. You get a lens of this by looking at this slide of what does, especially when we talk about childhood trauma, what it does and how it impacts us. Okay. So again, I told you it impacts your physical health. So a lot of times when we see youth that has mental health issues and behavioral health issues, a lot of it comes from early childhood trauma, unless it's something biological where it's impacting chemistry in the brain, your serotonin levels and all of that. And that's possible. But most of the issues when it comes to mental health and behavioral health issues, it comes from a lot of trauma where the brain has been impacted. Physical health. So you see, like, you may have some youth that's having sleeping disorders, eating disorders. Another thing about trauma is you may be working, especially with some young ladies that they have bulimia or anorexic. They struggle with eating disorders. Most definitely, trauma impacts the immune system. Why would that be important? Well, especially dealing with a culture and dealing with a society of COVID, and we coming back into the cold and flu season. Immune system is going to be very, very important to someone's health, because how can you fight infections and recover from the illnesses with a poor immune system? Okay. Emotional problems when we have early childhood trauma. So I'm hoping, does this slide make some sense, guys? Because I like to be engaging, interactive. Okay. So when you look at the emotions piece, you say, oh, no wonder. Mary, who I'm working with, or Tony, who I'm working with, or Michael, who I'm working with, or Emily, who I'm working with, are showing a lot of emotional issues. It's because of early childhood traumas impacts them. They have a difficult time even managing their emotions. Feeling. Sometimes kids get numb, and they just don't feel anything. And that makes building those relationships a little bit more difficult. Relationships. Early childhood trauma impacts relationships. Let me say this: childhood relationships and adult relationships. A lot of adults who have a difficult time with relationships usually has some type of impact of early childhood trauma that has not been addressed, nor have they healed from it. So by the time they're adults in friendships, romantic relationships, and in marriages, it does have a negative impact. Okay. So we even have adults that have these same issues as well. They don't attach properly. Their partner asks questions like, do you ever feel? You seem numb to everything, right? A lot of that stuff go way back when, into our early days, that we did not deal with. Okay, so think about that as well when we talk about early childhood trauma. And certainly we know trauma is a huge link to mental health, has a lot to do with trauma. Okay, that baby didn't come out of that mother's womb being depressed. Obviously, something had to happen in their life to open that door for them to become a depressed individual. Does that kind of make sense? Okay, so think about that as well when we talk about mental health. Behavior. So, man, we would have a whole lot more mentors if it was just that easy. If it was really easy, everyone would be being a mentor, right? So the reason why there's a select few who can handle being a mentor, because behavior is going to be a big piece. That means your job is not going to just be peaches and cream. You're just not going to kumbaya and just grab kids and it's just going to be a wonderful day in Alice in Wonderland. It's just not that simple, right? Trauma impacts behavior because it impacts the anterior cortex of the brain, where that helps people to stay regulated and manage moods. Well, if you can't stay regulated and manage moods, you're going to be all over the place with behavior. That's fine if you're just in a room by yourself, but if you are in a classroom, or if you are in a group, if you are in a space of people, then bad behavior is going to affect everyone around that individual. And so this is what makes working with at-risk youth and working with traumatized children and traumatized teens a big challenge, because you have to peel through the layers of the behavior to get to the why of why all of this is jumping off. So it impacts self-regulation, social withdrawal. So you're also going to see, have you ever had some kids that just withdrew from you? I mean, you throwing everything in the kitchen sink to connect, but they're throwing everything back at you and said, forget you. My mama don't love me. I don't know who my daddy is. And my grandmama said, I can't come over no more. So what you gonna do? Okay. And so that is really real. Okay. Sexually acting out has a lot to do with early childhood trauma, right? So a lot of times we say we want to deal with teenage pregnancy by giving them a program. No, deal with teenage pregnancy by dealing with why they're hurt and broken. Okay. Because obviously if they're acting out and being very promiscuous, some of that is coming from abuse, and yes, sexual abuse, being violated at very, very young age from a parent or from a family member or for a caregiver. A lot of that comes from trauma. And some of the teens are not out there because they just want to be out there acting that they having that risky behavior, but they're showing through behaviors that there's been some abuse somewhere, and they're trying to get someone's attention to understand that they've been wounded, they've been scarred in some kind of way. And so sometimes it shows in bad behaviors, it shows in acting out, it shows in aggression, it shows in defiance. And so we have to peel those layers of the onion and ask deeper questions to the whys of why is this youth acting like this? I don't believe in bad kids. I believe in kids that have been born and raised in some maladaptive conditions and some bad situations, and they're totally surrounded with bad people that at some point influence them to make bad choices and bad decisions that creates bad outcomes. Okay, but by the time you're mentoring them, 6 things have happened in their life, and you're getting them at the 7th stage, and now you got to push the reverse button and go back and figure out what in the world is going on. That kind of making sense? So remember I talked about brain development, and so I'm going to show you through a CAT scan, through brain imaging, what trauma does to the brain of individuals. But most definitely, it hinders and compromises growth, which means that a lot of people who have early childhood trauma, sometimes their brain are smaller than normal in healthy sizes. It impairs stress response, and it changes the genes in expression. So again, we talked about epigenetics, which means the trauma impacts DNA. And what happened? Why is that a concern? Because trauma can also change into being generational trauma, where trauma is passed to the next generation, and that cycle has not been reversed. Okay, and then cognition. Which means that trauma, if it impacts the brain, it rewires the brain, it injures the brain, then certainly it must compromise cognition, which means that academically, these are going to be the same kids that's going to struggle in the classroom, not because they're stupid, not because they're ignorant, and not because they cannot learn. It's because the brain injuries in the frontal lobe and the prefrontal cortex of the brain has been compromised. And so it impacts cognitive capacities and it impacts executive functioning. So when you have these things going on, you're going to have a mathematics problem. You're going to have a readings problem. Not because they can't read, it's because the fact that the brain is impacted, that it has a difficult time of learning. They're going to see delays in language. You're going to see problems with concentration. Aha, Dr. Holt. That all goes into my next point. Trauma can mask like other diseases and disorders. Problems with concentration. What does that sound like, y'all? Could that sound like ADHD? Could that sound like ADD? So do a lot of kids, is it possible too many kids are being overly diagnosed and misdiagnosed? Aha, Dr. Hope. I'm trying to point out some things, ladies and gentlemen. We are overly medicating kids, and we are misdiagnosing kids because we don't look at the trauma first. We go in and create diagnosis and then try to create treatments when the problem really is trauma. A lot of kids who have a difficult time having focus and concentration are not always autism and not always ADHD. So this is important, why we need to slow down and ask more questions, and we need to do these ACE scores before we even do an evaluation, because a lot of it comes from trauma. Now, I'm not saying that there's no legitimate cases of ADHD and autism and all of that, but the new science coming out, we are seeing there is a direct link to trauma and autism. The brain, ladies and gentlemen, has been injured, and it creates symptoms. And so if you just rush to look at symptoms to diagnose and describe individual's condition, it's easy to give all kids learning disorders. They all have learning disorders. Why? You got to go back and look at the trauma. Okay? So we have to slow down and understand the whole child. Make sense? Okay. So when I look at trauma, this is what I look at. Trauma should be the foundation. And then the programs that we have to address behaviors should be built upon the foundation of trauma. Because again, trauma talks about there's something going on in the brain that we need to heal and fix so that we can get better outcomes of the whole person. Well, because it takes the brain to do everything. It takes the brain to talk, takes the brain to walk, takes the brain to learn, takes the brain to remember, have memory. And if the brain is just not functioning well, you're going to have a lot of these issues. So I'd like to think about, from a comprehensive and a robust approach to trauma responsiveness, is to create addressing trauma from the foundational piece. And then we start looking at equity. And we then start looking at social emotional learning. And then we start looking at PBIS and bullying prevention and restorative practices. Many times I talk to people, they say, yeah, I need you to come and do restorative practices. And I say, well, why? They say, well, I really don't know. I just heard that that's the new thing out there. So, yeah. Have you looked at trauma? What's going on with the trauma thing? Well, I really don't understand what that's all about. I heard something about ACEs and I heard something about trauma-informed care, but we're not doing anything like that. No, start with trauma. Every time somebody asks me about doing anything on equity, on restorative practices, the first question I'm going to ask is, where are you at on being trauma-informed and being trauma-responsive? Because you're going to spend $1 million on how many of you guys do you guys have PBIS in Washington? Have you heard of it? Okay, this is framework down here in Arizona. Some of our areas is positive behavioral intervention systems or something. I think that's what it stands for. And pretty much it's behavior based. It's when kids showing bad behavior, we create systems where we can award them and give them recognition for some of the positive things they have. So it's called PBIS. That looks good on paper. That probably even look even more prettier on a PowerPoint. But the fact of the matter is, you don't improve behavior by just giving out treats. You got to go back and deal with what's going on the inside of them to get them regulated and get them out of a fight or flight type of mindset to relax and feel safe. Okay, so again, that's why I talk about trauma should be the foundation. How many of you guys heard of restorative practices or restorative justice? Okay. All that stuff is wonderful, right? But if you don't integrate trauma-informed or trauma responsiveness in the culture of the school, then it's going to be hard for educators and principals and deans of discipline to have more of a restorative mindset instead of just this punitive mindset, okay? So just throwing some things out there. All right, so let's look at it. So I told y'all what line, y'all thought I was making this up. Trauma impacts the brain, okay? On the right, you see an abused brain. On the left, you see a healthy brain. What is going on here? What we see is what I explained to you earlier in the training, is that we're not talking about just some Care Bear stuff. We're not just making this stuff up. The fact of the matter is that when individuals are living in some maladaptive conditions and some abusive conditions, it impacts the growth of the brain. It's no secret, guys. You can see a difference between the right brain and the left brain, right? You can see a left brain is fully developed, is stimulated, is on fire. You see all of the different red colors. Neurons and transmitters is healthy. They're doing their thing. On the right side of the brain, you see all of this. You don't see barely any bright red, no major stimulation. And you actually see a lot of openings in the brain that is showing that this brain is probably going to give you some behavioral or mental health issues as this brain gets older. Does that kind of make sense? Okay. So when we talk about trauma, we also have to talk about the neurobiological impacts of trauma. So trauma, obviously, it impacts a whole person, but there's five major areas and regions of the brain that trauma impacts. One, the prefrontal cortex, the amygdala, the hippocampus, your thalamus, and your HPA, your hypothalamus pituitary adrenal gland or axis of what we would say. All of this has a big piece of dealing with the threat response. So what does trauma do to people who are going through a lot of trauma? It keeps your brain on high alert. Now, for a short term, that's healthy, right? Because your brain is trying to help you get out of a dangerous situation. And so for your brain and your body to have this neurobiological response and put you into this fight, flight, or freeze type of mechanism is to save your life. So if you're in a school and somebody say there's a live shooter, and you're hearing him shooting off rounds and you're hearing people scream for their lives, you better believe your brain is going to respond. It's going to immediately shift into a high alert and get into a situation to where your thalamus is going to use sensory perceptions to pick up the threat. Your amygdala, your fear center is going to assess that threat. Your hippocampus, which is your short-term and long-term memory region of the brain, is going to be use memory to assess this. Your hypothalamus pituitary adrenal axis is what releases cortisol, the stress hormone, into the body, which makes the body have this response. So your pupils dilate, your breathing change, your heart began to really race, your muscles constrict. What is all this for? This is to save your life out of a dangerous situation. And when your body responds like this, ladies and gentlemen, that's how it's supposed to respond on a short term, and I'm emphasizing that, only for short term, okay? But when the threat has removed itself, your body goes through this calming. And so you're no longer in that fight, flight, or freeze type of response, but you're now calming down. Now, the question I want to ask you guys is, what happens to some of your kids that have a live shooter mindset every day? What happens when the brain is constantly on high alert every day? What happens when kids live with rattlesnakes and big bears every day? What happens is the brain is constantly on high alert, and the brain never gets to turn off. Again, I emphasize it's doing its job when it's short term, but should the brain be overly stimulated on a long-term basis, should the brain constantly be on high alert and your muscles constricting and your pupils dilating and you have this neurobiological response every single day, that begins to be a problem. And that's when that's not healthy, because your brain should not be in that limbic system part of the brain that's keeping you in survival mode. You need to get back into being in normal mode. And when we have that response of the brain doing all of that business, it begins to impact you psychologically, emotionally, mentally, and most definitely physically. It makes you even sicker. So I show you what trauma does on those 7 different points of cognition, emotion, physical, mental health, all of that, okay? So also trauma impacts implicit memory, and it also impacts explicit memory. So that means if it impacts memory, then trauma also impacts your hippocampus. And the hippocampus is the part of the brain where you have memory. This is where the hippocampus remember when bad things happen to you. You may not know all the details and all of that at the moment, but that hippocampus reminds you that something happened to you. And this is the reason why you're triggered on some things. And even as a professional at your age, you may have experienced some traumatic experiences when you were younger. And if you smell, or if you see something that reminds you of that event, your hippocampus timestamps events and say, oh yeah, right? So it impacts your somatic, your episodic, your procedural, and your emotional memory. So when people have these traumatic triggers, how do you get a trigger? Because it impacts your memory. Okay, and so it impact it. You are reminded, if, especially if you've been assaulted and you smell someone's cologne, you immediately can go right back to that place. Okay, because trauma impacts memory. If you are 9 years old in a very bad car accident, and you are at a particular place, maybe by a lake or maybe by some river. And so you go back and go back to a road very close to a river or a lake, and all of a sudden you begin to feel like a panic attack is coming over you. Is because your memory has been impacted by trauma. Okay. All right. So don't want to bore you on all that. Just want to share some things. So let me get to the final part, and the good part is that how do we reverse it? Okay, because everybody talks about trauma. That's the big buzzword, right? But the big question is, how do we reverse the impacts of trauma? I call it the R factors of healing. One, relationships, resources, relationships plus resources plus many other, like relaxation. I have some other R's in there. It opens the door to resilience. So one of the most important things with people that have high levels of trauma, what we see is people that was able to help bring healing in those spaces, is through the power of relationships. So I would tell you, yes, that we need love. Kids need love, especially kids who have really had a difficult time of being abused and been rejected, who have been marginalized, who've been ostracized and disenfranchised. They need a lot of love. So mentors, I hope you have a whole lot of love to give, because you're going to have to pour a lot of love in a lot of our youth. What the world needs now is love, sweet love. Tina Turner said, "What's love got to do with it?" Let me tell you, everything has everything to do with love. Okay. So loving relationships creates healing. Now, what's the science in that, Dr. Holt? I'm glad you asked me. The science of it is that when people feel love, the brain stops being in high alert, because that's our big problem, right? As long as the person feels threatened, as long as the person feels that their environment is not safe, as long as they feel that their environment is full of abuse and attacks and rejection and poverty and violence, domestic violence and divorce, and if these things are constantly in the lives of individuals, they're never going to feel safe. And so the brain stays on high alert. So how do we get this brain to shut down from being on high alert and hypervigilant? Loving relationships. Love, 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 love is the key. Okay, and that's why I said at the beginning, if you don't love kids, you're probably you're doing the wrong thing. You're in the wrong vocation. You're in the wrong field. You have to love, 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 love. Now, in order to love, you got to make sure you're full of love, because you have to pour that love into these kids. Okay, so this is more than just some extracurricular activity that we're doing to tie up some time because I'm bored. No, this is going to be a lot of work, and it's going to take a lot of love to do it. We see that kids perform better when caregivers show kids a lot of love. They just behave better, they learn better, and they just act better, and they perform better when love and kindness is in the room. Dr. Bruce Perry said, the more healthy relationships a child has, the more likely he will be to recover from the trauma and thrive. Relationships are the agents of change, and the most, not just powerful, the most powerful therapy is human love. Okay? So when kids are acting out, we just give them antidepressants and we get them Ritalin and we just give them all kind of different medications, but love is not there, then you're just doping kids up and you're not impacting, making those long-term impacts. Love has to be the key, okay? Healing relationships is some of the most powerful antidotes of helping people heal from trauma. Now, oxytocin, let me speak into oxytocin. So love is not just a feeling, love is a hormone. There's something that goes on in your brain when there's love in the room. right? We know dopamine, that's the pleasure hormone, but oxytocin is the love hormone. We see that when people get hugs, real loving hugs with embrace, with people that they love, or even their pet, they don't even have to be a human. If your favorite dog, when you come home and you see that dog get excited and they jump on you and want to lick on you and show you a lot of affection, there we see that oxytocin is released. That's the love hormone. The problem, what we're seeing is we're seeing too much of the wrong hormone of cortisol. Cortisol is the stress hormone. We have too much cortisol in our agencies, too much cortisol in our schools, too much cortisol in our homes. What we need is to shift that hormone from cortisol to oxytocin. And that is what you spend. When you get that real, that pleasure feel, when that person really loves you, give you that hug and let you know that everything is going to be okay, you've had a bad day, or you're not in this alone, there's a release of this oxytocin. You get this feel all over your body from the release in your brain of oxytocin. So I just want to throw that in there, is that when we're showing love to a lot of our kids and our youth, we want to reverse cortisol into oxytocin. We want to have an oxytocin release, if that kind of makes sense. Isn't that some good stuff, guys? Yes, yes, it is. I eat and sleep this stuff. So when you go home, when you tell your loved one, when you hug them and kiss them, they're like, "What you doing that for, baby?" "I'm trying to release the oxytocin." We're releasing the love in the room, right? And love is contagious, okay? And that's what we want, okay? And so to build oxytocin, what's the next word? Trust. So you're gonna have trust in order to be oxytocin. It's hard you can't just go into oxytocin and you didn't build no trust in the relationship. If people don't trust you, you're still going to have a lot of cortisol than oxytocin. So you really want that infection, that love type of hormone to be released. There's ways how we have to build that. You're just not going to build that because you want to. It got to be intentional. It has to be strategic. It has to be consistent. And it has to be persistent. And it has to be on purpose. Okay. So trust has to be in the room. So we got to look at trust is a big thing. And so we want to make sure we have engagement and retention, well-being, innovation, and performance in order to build trust. And then building trust with love creates this release of oxytocin in the room, okay? By eye contact, by a hug. Oxytocin released by holding hands, through a kiss, or play music and dance. Even when you dance with someone, it can be a friend or a romantic partner, you feel that type of oxytocin being released. Okay, so trust is a big thing. And so if we're gonna be working with kids and releasing this love hormone, we have to develop trust. And that comes from relationship. And relationship building is built off trust. So it's more than just say, hey, build relationships. A lot of people say, well, how do I build these relationships? And this is what I'm going through right now. Look at your trust, your trust factor. Reliability. Never say anything to these kids and you don't follow through with it. I can tell you right now, you might as well hang it up and go on and leave it alone. If you mess up and make a promise with these kids, and every system they know have failed them this far, and so they're putting their trust in you, one of the huge mistakes is to make a promise that you do not keep. That relationship is probably going to be severed and severely damaged because they're taking a leap of faith to put their trust in you when everything else has failed. So please think about reliability, being reliable, sincerity, integrity, consistency is going to be huge. Continue to keep doing it because maybe they're trying to see how long are you with them and how are you in this thing for the long haul. So that's the thing we have to look at. Commitment and competence as well. Okay, few things are harder to earn and easier to lose than trust. So always think about that. Few things are harder to earn and easier to lose than trust. Trust is a big issue. It's really, really hard to build it. As soon as you violate one violation of the trust, you lose the whole relationship. So think about those things. Shame and guilt. A lot of times individuals are struggling because they've already made a lot of bad choices. They've already been told that they won't become anything. They've been rejected, they've been put down. So these some of the layers of the onion that you have to peel through to work with kids that will have a lot of trauma. They made some bad choices, some choices that they are ashamed of, some choices that they're probably having a difficult time talking about. So shame and guilt is also a part of that. So you probably experience that some of those layers is going to be shame and guilt as well. Okay. And they wondering, how do you look at them? So you probably spend a lot of time saying, I'm not judging you. I just want to get to know you. I'm not judging you. I'm just trying to get an understanding of you. A lot of times, if you have to spend a lot of time dealing with that, is because of a lot of shame and guilt. Okay. And so shame is really and guilt, there's two different things, but they go together. Guilt is feeling bad about your behavior. Shame is feeling bad about yourself. Okay. Guilt is feeling bad about the behavior. Shame is about feeling bad about yourself. So these are two big things that you have to deal with. And this also can impact their self-esteem, their self-value. This opens the door as well for self-harm. So you may have some that like to cut themselves or do some type of self-destructive behavior towards themselves, is because guilt and shame is that powerful. Again, guilt is feeling bad about the behavior, and that's enough to make you depressed. But then what makes it worse is when shame comes in and you feel bad about yourself, okay? So we want to make sure that we are bringing self-regulation to the table. So that's another art of healing, self-regulation. All right, making sure that they're regulated, making sure that we try to keep them from being dysregulated, and also making sure that you yourself keep yourself from being dysregulated. Because again, a caregiver and a mentor that is dysregulated cannot help dysregulated youth. So you have to make sure that you are okay and you're fit for the fight, for the long journey that's ahead of you. Relaxation is another art of healing. So we got regulation and then we have relaxation. So sometimes, kids that are really disturbed, that are really highly triggered, need to be practicing some type of mechanism of relaxation. That can be mindfulness, that can be meditation, that can be yoga, that can be journaling. Some kids do well on journaling, getting all of their emotions on paper, and do some journaling. So there are many different ways to help kids get relaxed. I would say also circles is very, very powerful. Community circles, restorative circles is very powerful for relaxation as well for kids. Okay, so there are some things that are out there that we can be using to be trauma responsive, to help kids address their trauma. So I also try to get mentors to get educated on restorative practices too, to help kids address some of their bad choices. And circles is really, really very powerful when helping kids to stay regulated in relaxation. So resilience is where we get to. Okay, so a lot of times if you say they're resilient, how do you get resilient? No, we have to provide certain things to help kids become resilient. It just automatically a lot of times just come resilient on their own. They need relationships, they need relaxation, they need regulation. Okay, they need restorative practices or restorative justice. They need an avenue sometimes on how to get back on the right track when they have made some horrible decisions. Then we get to this level of resilience where they have the mechanisms, they have the capacities to bounce back from their setbacks, okay? And that's the big, huge thing about dealing with trauma, is that we have to promote resilience. We just don't just stereotype kids and say, well, they had a bad life, they had a bad early childhood life, so their expectations, they really can't amount to anything. That's not helping the kids either. You have to have great expectations. I just ask that it be equitable expectations. You don't have expectations for one group of kids and then you have another expectation for another group of kids. Make sure that kids don't remind, one of the things when I did the focus group on the high school from 9th to 12th grade, none of them had a problem with expectation. They had a problem with inequitable expectations, where it wasn't equity wasn't in the room. It wasn't equal and it wasn't equitable for all kids, so they impact their incomes. But when we love on kids, it's no secret what they can become. They can rise above it. They can become something great. And we have to push more resilience and more grit with trauma-informed care and trauma-responsive practices. I always say that trauma may not be your fault, but it's certainly your responsibility to heal from it. Because if you don't heal from your trauma, you will bleed on people that didn't cut you, because hurting people hurt people. The reason why people hurt people is because they have a lot of hurt on the inside. And so we want to catch them as early as possible to create these spaces of healing. And so finally, before I'm done, and maybe perhaps you may have some questions, let's talk about your self-care. Ladies and gentlemen, trauma is real. Secondary trauma is real. Burnout and compassion fatigue is something else right now. And everyone is feeling it. I'm seeing there's one school that was so impacted by secondary trauma that the teachers was not mentally and emotionally fit to teach, and the substitutes wouldn't even report to work. So they had to shut down schools because of trauma is just that powerful. Secondary trauma is impacting our law enforcement community. We're seeing more dysregulated officers than we ever had because of mental health and social emotional issues that we're seeing with our first responders. That's our paramedics, that's also our firefighters, that's our RNs, that's our physicians. Secondary trauma is real. Okay, so one of the things I want you to be looking at as mentors, working with people, a lot of trauma is we're looking at your mental wellness. We talk about mental illness, but we don't talk a lot about mental wellness. And mental illness is fine. That's being more reactive. But mental wellness is being more proactive, getting ahead and making sure that you are mentally and emotionally well to do your job. Okay. And so it impacts our professionals that we depend on every day. Our medical professionals, first responders are impacted with secondary trauma. Social workers are impacted with secondary trauma. What about our 911 dispatchers who are hearing traumatic events on the phone for 12-hour shifts over and over and over, from murders, from homicides, to sexual assaults, to children being molested or being abused, from horrific car accidents and things of that nature. Just think about the brains of people that we depend on every day to help us when we are in need. So staff burnout is why I'm having these conversations. Are you suffering from burnout, or have you ever been in a place where you felt like, I just don't feel okay? And how does it impact you physically? How does it impact you emotionally? How does it impact you mentally? Is a good question, okay? And so some of the times we need to be able to pay attention to the symptoms as well. If you are feeling burnout and compassion fatigue, there are symptoms. If you're seeing chronic exhaustion, reduced sympathy or apathy, feeling of anger, dreading to go to work or dreading to come in, poor job satisfaction, hypersensitivity, and imbalance work life, difficulty sleeping, suffering from insomnia, can be some signs you need to look at. Grief is a big issue. Maybe someone is grieving because someone passed away, or and grieving is not just with death, guys. You can grieve going through a divorce. If your whole life is being turned upside down, yeah, you're gonna go through not only grief, but 5 stages of grief. You're gonna have that denial piece. You're gonna have that piece where you're just so angry and just full of wrath that how can this has happened to me, and how come I didn't see this coming? There's the bargaining stage, there's the depression stage, and there's the acceptance stage where you just finally say, whether it's good, bad, and ugly, I just have to deal with the deck of cards that has come in my life so I can rebound it. So think about grief as well being something. More injury, which I don't have a whole lot of time to talk about, but more injury most definitely can be a big thing. So the question is, what do your self-care tank look like? Do your self-care tank look like this? Or do your self-care tank look like this? Or do your self-care tank look like this? I hope you're self-reflecting. I want you to all be thinking about your own self-care. Or do it look like this? Dr. Holt wants your tank to look like this, okay? So you have to be spending more time pouring in yourself, okay? And doing things that is to keep you healthy. I have a lot of people say they feel bad about taking time off. Are you nuts? Are you crazy? No, do something for yourself. How many lives do you get? One. So you need to take care of it. You know what, guys, what blows my mind is some of you guys, your BMW and your Escalade and Lexus get better self-care than you. We would go and get oil changes, we get tune-ups without even thinking about it. But when it comes to your wellness and your mental wholeness, it's like we put that in the second or third category as if it's not a priority. No, take care of yourself. Do something that makes you happy. Do something that keeps you balanced. Do the things that you need to do to keep you whole. So I'm gonna give you this last slide for you to look at it for the sake of time. Is when I talk about self-care, I'm talking about on 8 different levels. A lot of times we say self-care, we think about one thing. But actually your wellness has 8 dimensions. I'm talking about you, not the kid anymore, not the youth, I'm talking about you. What do your self-care look like physically? Do you drink enough water? Are you putting the right fuel in your body physically? Because that may have something to do with chronic disease and fatigue, right? What does occupational self-care look like for you? What does mental self-care look like for you? Okay? You might need a therapist. I don't care how many degrees of education you have. No one is exempt of making sure that mentally that we are okay. Okay? And let me tell you that there are times you will not be okay. And I'm going to tell you there are times it's okay to not be okay. There's a time you need to take that professional hat off. You wear that hat too much. Okay? You need to relax. And you need to laugh. When I had a good crack up to where your stomach hurt. You know, sometimes you need therapy and sometimes you need to go see Kevin Hart at a comedy show just to get your dopamines going, your pleasure hormones going, and just relaxing a little bit. Some of us are too deep. You're too serious. You don't smile. When people look at us, people wondering, did they do something wrong? So I'm cracking my own self up. So look at all of the parts. Environmental self-care is important. Making sure that you have a especially occupational self-care. You don't want to work in a place where there's low morale. You don't want to work in a place where you can't trust your colleagues. Everybody's attacking you. Everybody got a plan and a motive to attack one another. And so it's not even fun to go to work, okay? Environmental, social self-care is important. Let me talk a little bit about that. Sometimes you are healthy, but everybody in your inner circle are toxic. And you're wondering why you are more exhausted, you are more stressed, when you get around certain people, is because perhaps you need to be practicing social wellness. And that may mean you need to put people in their right categories, and you can't take everybody with you. There are some people that are dead weight and they've been dead weight since kindergarten, and you're trying to carry them somewhere that they just don't want to go. Okay, so put people in their right categories. Okay, social self-care. Everybody ain't your friend. Quit calling all them people your friend. They ain't your friend. They may be your colleague. They may be a work buddy. They may be a lunch buddy, but that don't mean that you're your friend. So social wellness will help you to put people in their right categories. And yes, I'm going to blow your mind. Some of those people may be in your family, and some of those people may share the same last name as you. Okay? Intellectual wellness. Always have a teachable spirit. Never get into the mindset that you are know-it-all and you can't learn new things. That is not practicing intellectual wellness. Intellectual self-care is having a trainable spirit, having a teachable spirit, always want to be better, always want to sharpen their craft. If you are an expert in something, you can't get lazy at what you do. You have to keep being informed and constantly challenging yourself to practice sharpening your craft and sharpening your gift, okay? Or going back to school. or going back getting that master's, or going back getting that doctorate, whatever that looks like. Financial wellness. Ain't no stress like money stress. Okay, so you want to make sure you keep your stress levels as low as possible, and debt will do it for you every time. It is hard to focus when mentally you're thinking about money issues. Okay, and everybody have a time where, you know, budget gets a little tight. I'm not talking about that. I'm talking about where debt is just making you a slave. Okay, and you feel like you are in chains of the next bill, and as soon as you get your direct deposit hit that account, you mad and pissed off because you know that it's going to go somewhere. Okay, so you want to also be practicing financial wellness, and practice and position yourself for short-term and long-term goals. Spiritual wellness, that may be church, that may be a worship, that may be a prayer meeting, that may be a Bible study, but it also may be yoga. That may be meditation, or whatever that looks like, right? Practicing the spiritual part as well, because remember, I told you from the beginning, the trauma does impact your spiritual. So I'm out of time, guys. I know y'all tired of me. I hope that I helped you. I hope that this has been inspiring and motivational. You can heal from trauma. You can bounce back. Let's create healing. Let's make an impact in our kiddos' lives so that we can reverse generational trauma in the next generation. This is Dr. Holt. Thank you for your time. And if you have any questions, I would love to talk to you.
Thank you so much, Dr. Damon Holt, for spending your Monday evening with us. I hope that we can continue to elevate and share your wisdom on trauma with both of our mentors and our providers. If any of the attendees today would like to access the recording, you can shoot me an email and I'll send that in the chat right now.